Did you know that more than 80% of people who use baking soda, also known as sodium bicarbonate, NaCO3, have no idea about its most remarkable benefits? This everyday kitchen staple, costing only a few cents per serving, is a powerful alkaline compound with a long history of use in traditional health practices, yet many experts believe its true potential is being overlooked. In fact, some health professionals have even described baking soda as the most underestimated household remedy on earth. While most of us reach for it when baking bread or keeping the refrigerator fresh, this simple white powder has surprising health applications that come directly from its unique chemical properties. So why is so little said about its real power, and what might we all be missing? This video uncovers the proven health benefits of baking soda and explains the science behind how it works. We will also share insights from major health organizations, along with important precautions and contraindications. By the end, you'll have a responsible, well-rounded understanding of how to use baking soda. This is something you will not want to miss, especially if you care deeply about your health and want to make wise, informed decisions. The remarkable health benefits of baking soda first. Let's look at its role in supporting detoxification. Baking soda is not just a cleaning agent or a baking ingredient, it is also valued for helping the body's natural detox processes. When dissolved in water, baking soda becomes alkaline, meaning it can help neutralize acids both inside and outside the body. Many people use it to calm irritated skin, relieve itching, and soothe minor rashes. The idea is that soaking in a baking soda bath may help remove impurities, refresh the skin, and restore balance. Although scientific research on detoxification through the skin is limited, many people report clear relief and comfort. The soothing properties of baking soda are not limited to general baths. There are specific chemical reasons behind its effects. Insect bites, such as those from bees or fire ants, often release acidic compounds like formic acid into the skin. A mixture of baking soda and water, which is alkaline, can directly neutralize these acids and reduce pain and itching almost immediately. Baking soda also has mild anti-inflammatory qualities that can ease the histamine reaction responsible for rashes and itching from poison ivy. When skin is inflamed, its natural pH is often disrupted. A cool bath with baking soda may help restore a more neutral pH, which reduces irritation. In cases of sunburn, compresses or baths with baking soda provide a cooling sensation as the water evaporates and draws heat away from the skin. The story becomes even more interesting when we look inside the body. Some health enthusiasts believe that drinking small amounts of baking soda dissolved in water may help the body maintain better acid-base balance, making it easier to eliminate waste. Research does provide some support for this, particularly in people with certain medical conditions. For example, a study published in the Journal of the American Society of Nephrology found that sodium bicarbonate supplementation helped slow the progression of chronic kidney disease by reducing acid buildup in the blood. This suggests that, under medical supervision, baking soda may play a role in supporting the body's natural detox systems, especially in patients needing help controlling acidity. It is important to clear up a common misunderstanding. Baking soda does not flush toxins from the body directly. Instead, its main role is to support systems like the kidneys by helping regulate acid levels. To understand how this works, let's explore the body's natural mechanisms. Human blood maintains a very tight pH range of about 7.35 to 7.45 through the bicarbonate buffering system. In chronic kidney disease, the kidneys lose their ability to excrete acid effectively, leading to a condition called metabolic acidosis. This acidic environment accelerates kidney damage over time. Oral sodium bicarbonate serves as an external source of bicarbonate, strengthening the body's buffering system. It neutralizes excess acid in the blood and reduces stress on the kidneys. A landmark study in the Journal of the American Society of Nephrology demonstrated that patients with chronic kidney disease and metabolic acidosis who received daily sodium bicarbonate supplements experienced slower kidney function decline and had a lower risk of needing dialysis. The National Kidney Foundation also recognizes that treating metabolic acidosis is essential in chronic kidney disease care and physicians may prescribe sodium bicarbonate after carefully monitoring blood chemistry. However, this is strictly a medical treatment, not something to try on your own. Using baking soda without professional guidance for kidney problems can be extremely dangerous. Incorrect dosages may lead to fluid overload, high blood pressure, or even heart failure due to excess sodium. For men in particular, this highlights a larger lesson. Men's health often suffers from a tendency to avoid medical advice and rely on home remedies alone. But as this example shows, the safest and most effective approach is to combine wisdom from everyday life with responsible medical supervision, an outstanding aid for removing pesticides from produce. Another unique benefit of baking soda, which is rarely discussed, is its ability to help clean fruits and vegetables more effectively. Washing fresh produce with plain water is a common habit, but it often fails to remove certain pesticides that are designed to resist rain. Baking soda, however, provides a surprisingly effective solution. A 2017 study from the University of Massachusetts, published in the Journal of Agricultural and Food Chemistry, compared the effectiveness of tap water, a commercial bleach solution, and a 1% baking soda solution in removing two common pesticides, thiabendazole and phosmet, from apples. The results showed that the baking soda solution was by far the most effective. After soaking apples for 12 to 15 minutes, it removed 80% of thiabendazole and 96% of phosmet. The alkaline nature of baking soda helps break down and degrade pesticide molecules, making them easier to wash away. In contrast, bleach solutions were less effective and pose their own health concerns. To use this method at home, dissolve 1 teaspoon of baking soda into about 2 cups of water. Soak your produce for at least 2 minutes or up to 15 minutes for a more thorough clean, then rinse carefully. 2. Improving oral health and whitening teeth. Baking soda has also earned its place in countless toothpastes and home remedies for a reason. It is a simple and effective ingredient for maintaining oral health and whitening teeth. If you have ever brushed your teeth with a small amount of baking soda, you may have noticed how smooth and clean they feel afterward. While some believe baking soda is a harsh cleaner, in reality, it is a very mild abrasive. This can be measured by the relative dentin abrasivity, RDA scale, which evaluates how much a substance wears down enamel. Baking soda has an RDA of only 7 out of 250, making it far less abrasive than most commercial whitening toothpastes, which often exceed 100 on the scale. This allows baking soda to remove stains from the surface of teeth, such as those caused by coffee, tea, or certain foods, without causing significant enamel damage. Unlike strong whitening treatments, its gentle texture polishes teeth safely when used correctly. The benefits extend beyond a brighter smile. Because baking soda is alkaline, it helps neutralize acid in the mouth. This is vital since acidic conditions encourage harmful bacteria to thrive, leading to cavities, gum disease, and bad breath. By restoring a healthier pH balance, baking soda creates an environment where bacteria struggle to grow, supporting stronger gums and fresher breath. The American Dental Association has awarded its seal of acceptance to certain toothpastes containing baking soda, confirming their safety and effectiveness. The Journal of Clinical Dentistry has also published studies showing that baking soda toothpaste is more effective at removing plaque than non-baking soda varieties. Another study found that baking soda can help lower the amount of harmful bacteria in the mouth, further supporting oral health. Still, moderation is essential. Even though it is mild, overuse or aggressive brushing can eventually wear down enamel. Dentists recommend using baking soda only a few times a week and always with a soft, bristled toothbrush. With the right approach, baking soda can be an affordable and simple way to achieve a cleaner, brighter, and healthier smile right at home. For many older adults, including men who often put off dental visits, this can be a practical habit to maintain oral health and confidence in everyday life. 3. Supporting cancer treatment as an adjunct. The idea that baking soda might play a role in cancer treatment may sound surprising, but it is an area of growing interest in the scientific community. Cancer cells are known to thrive in acidic environments. This acidity not only supports their growth, but can also make them more resistant to certain therapies. Because baking soda has natural alkalizing properties, researchers have studied its potential to change the pH surrounding tumor cells, making the environment less favorable for cancer progression. One of the most intriguing studies on this subject was published in 2009 in the journal Cancer Research. In this study, researchers injected sodium bicarbonate into mice with metastatic breast cancer and found that it significantly reduced the acidity around the tumors. This shift in pH slowed the spread of cancer and made the tumor cells more vulnerable to chemotherapy. This remains one of the most experimental and debated areas of baking soda research. Baking soda is not a cure for cancer, but scientists are exploring its potential as a supportive therapy. Cancer cells often exist within an acidic protective bubble known as the tumor microenvironment, or TME. This acidic TME promotes cancer growth, invasion, and resistance to both chemotherapy and immunotherapy. Animal studies published in journals such as Cancer Research suggest that oral or injected sodium bicarbonate may help buffer the acidity of the TME. By making this environment less acidic, it may slow tumor progression and increase the effectiveness of conventional treatments. However, these findings have sometimes been dangerously misinterpreted by supporters of so-called alkaline diets, who claim that you can prevent or cure cancer by changing the body's overall pH. From a biological standpoint, this is impossible. The human body tightly controls blood pH within a narrow range of 7.35 to 7.45 through natural systems involving the lungs and kidneys. Any significant deviation from this range would be a medical emergency, not a therapeutic benefit. Cancer cells create localized acidity as a byproduct of their metabolism, but this does not mean cancer can be treated by alkalizing the entire body. At present, organizations such as the National Cancer Institute emphasize that this research is preliminary and has not been proven effective in human clinical trials. Most importantly, patients should never attempt to self-treat cancer with baking soda. Doing so can cause severe electrolyte imbalances, which may be life-threatening and interfere with life-saving medical treatments. If you or a loved one is undergoing cancer treatment, it is essential to consult your doctor before considering any supplements or new therapies. Responsible guidance from qualified medical professionals is the only safe path forward. 4. Relieving heartburn. This is perhaps the most well-known medicinal use of baking soda. It works as a strong and fast-acting antacid. Heartburn is a common and often uncomfortable sensation that many people experience, especially after enjoying a rich or spicy meal. It begins as a burning feeling in the upper stomach and can rise into the throat. The cause is stomach acid flowing back into the esophagus, a condition known as acid reflux. Other factors such as swallowing disorders, eosinophilic esophagitis, weight gain, or pregnancy can also increase the risk of heartburn. The process is straightforward. Heartburn occurs when hydrochloric acid from the stomach moves upward into the esophagus. When baking soda or sodium bicarbonate is consumed, it triggers a simple acid-base reaction. This reaction converts the strong stomach acid into harmless table salt, water, and carbon dioxide gas. The neutralization happens almost instantly. The carbon dioxide produced is what causes the familiar belching sensation that often follows. Medical organizations such as the Mayo Clinic and the American College of Gastroenterology recognize sodium bicarbonate's effectiveness in offering short-term relief. However, they also caution against frequent or long-term use for several reasons. The stomach can overcompensate for rapid neutralization by producing even more acid later, which may worsen the problem over time. In addition, 1 teaspoon of baking soda contains more than 1,200 milligrams of sodium, which is nearly half of the recommended daily limit. For individuals with high blood pressure, heart failure, or kidney disease, this sodium load can be especially risky. Prolonged use may also disrupt the stomach's natural acidity. weakening digestion and nutrient absorption. Despite these warnings, the appeal of baking soda lies in its simplicity. Long before commercial antacids filled pharmacy shelves, many families relied on this inexpensive kitchen remedy. Mixing a teaspoon of baking soda into a glass of water and sipping slowly provides rapid relief from heartburn. The scientific explanation is clear. Baking soda's alkalinity neutralizes the excess acid that causes the burning sensation. A review published in the journal Digestive Diseases and Sciences highlighted its quick action in easing ordinary heartburn symptoms. The method is uncomplicated and inexpensive. No need for costly treatments or prescriptions. A small measure of baking soda, a glass of water, and a few minutes are often enough to restore comfort. For older adults who may find themselves dealing with heartburn more frequently, this humble remedy remains a trusted household solution. Used wisely and in moderation, it can make a meaningful difference, helping people return to daily life with greater ease and comfort. 5. Antifungal properties. Fungal infections are a common problem, often showing up as itchy, red, or flaky patches on the skin, especially in warm and damp areas like the feet. Athlete's foot, ringworm, and similar conditions occur because fungi thrive in moist environments. While there are many over-the-counter creams and sprays available, a simple and natural remedy can be found right in your kitchen: baking soda. What makes this household ingredient effective against fungi is its ability to disrupt the environment these organisms need to survive. When applied to the skin, baking soda creates an alkaline surface that weakens the fungal cell walls, making it harder for them to grow and multiply. This is not just a folk remedy passed down through generations. There is scientific evidence supporting its potential. A study published in the journal Mycopathologia found that a solution containing 10 grams of baking soda per liter inhibited the growth of 80% of fungal strains tested. These striking results highlight the promise of baking soda as a natural antifungal agent. Using it is straightforward. A simple paste made from baking soda and water can be applied directly to the affected area, or it can be added to a foot soak to ease and treat athlete's foot. Many people notice reduced itching and discomfort after just a few applications. Because it is gentle and non-toxic, it is also an appealing choice for those who prefer to avoid stronger chemical treatments. For anyone dealing with persistent fungal infections, this affordable and accessible remedy offers a hopeful alternative. It provides comfort, restores ease in daily living, and can help older adults regain confidence by keeping skin healthy and irritation-free. 6. May help reduce urinary tract infections, UTIs. Urinary tract infections, often called UTIs, are a common and painful condition, especially among women. The burning sensation during urination, frequent urges to go, and overall discomfort can disrupt daily life in difficult ways. While antibiotics remain the standard and most effective treatment, some people explore natural methods to ease symptoms and support recovery. One such approach that has drawn attention is the use of baking soda. The idea behind using baking soda for UTIs comes from its ability to neutralize acid. When dissolved in water and consumed in small amounts, baking soda can make urine less acidic. This shift in pH may create an environment less favorable for bacteria that cause urinary infections, possibly slowing their growth and helping the body fight the infection more effectively. In addition, less acidic urine may reduce the burning pain that makes UTIs so uncomfortable. Scientific research has offered some support for this method. In a study published in the Japanese Journal of Urology, 33 women with recurring UTIs were given sodium bicarbonate as part of their treatment plan. After 4 weeks, many participants reported significant improvement in their symptoms, including reduced pain and less discomfort while urinating. These results are promising, but it is important to stress that baking soda should never replace medical treatment for UTIs, especially in severe cases. For those who want an additional way to manage discomfort alongside prescribed therapy, baking soda may offer a gentle and inexpensive option. Still, persistent or serious UTI symptoms must always be addressed by a healthcare professional. Used wisely, baking soda can be a supportive addition to managing urinary health and improving daily comfort. 7. May help treat mouth ulcers. If you have ever dealt with the painful sting of a mouth ulcer, you know how much these small sores can interfere with daily life. The good news is that baking soda may provide a simple and affordable remedy. Mouth ulcers, also known as aphthous ulcers, often appear due to stress, minor injuries inside the mouth, or even certain foods. They can make eating, drinking, and even speaking uncomfortable. Baking soda, or sodium bicarbonate, works in these cases by neutralizing acid in the mouth and helping to restore a more balanced pH. This is important because an acidic environment can slow healing and worsen irritation. By rinsing with a solution of baking soda and water, about half a teaspoon dissolved in a cup of warm water, you can reduce inflammation, ease the pain, and support faster healing. This is not just a home remedy passed along through tradition. Science supports its benefits. A study published in the Journal of the American Dental Association found that rinsing with sodium bicarbonate significantly reduced pain and improved healing in patients with recurring aphthous ulcers. Researchers concluded that baking soda's mild antiseptic and anti-inflammatory effects help keep ulcers clean while reducing bacterial growth, which is essential for recovery. Unlike some over-the-counter treatments, baking soda is gentle and less likely to cause further irritation. So the next time you feel a sore developing, try rinsing with baking soda. It is a natural and scientifically supported way to reduce pain and protect your oral health right from your own kitchen. Natural deodorizing effect. In a similar way, if you are looking for a simple and natural method to stay fresh throughout the day, baking soda can also be the answer. Its secret lies in its ability to neutralize the acidic compounds in sweat that cause body odor while also absorbing excess moisture. By reducing acidity, it limits the environment where odor-causing bacteria thrive, helping you stay comfortable even on your busiest days. The natural deodorizing effect of baking soda is not just folklore. A study published in the Journal of Cosmetic Dermatology confirmed that sodium bicarbonate, when applied to the skin, significantly reduced underarm odor. Researchers explained that its alkalinity helps counteract acids produced by sweat and bacteria, which in turn minimizes unpleasant smells. An added benefit is that baking soda contains no parabens, aluminum, or artificial fragrances, making it an appealing choice for those with sensitive skin or anyone who prefers to avoid strong chemicals. For older adults who value both health and simplicity, this household ingredient provides a safe, natural, and effective option for daily freshness. 8. Enhancing exercise performance. Did you know that a common kitchen ingredient could give you a real edge in physical activity? That's right. Baking soda is not only useful for baking or cleaning, it has also been used as a secret tool by athletes to boost performance and fight muscle fatigue. During high-intensity exercise, such as sprinting or weightlifting, the body produces energy through an anaerobic process, which means without oxygen. A byproduct of this process is the buildup of hydrogen ions. These ions lower the pH in muscles and create the familiar burning sensation that comes with fatigue. This acidic environment also interferes with the enzymes that are essential for energy production. When baking soda is consumed before exercise, it increases the level of bicarbonate in the blood. This acts as a buffer, helping to move hydrogen ions out of the muscle cells more efficiently. The result is a delay in muscle fatigue, allowing athletes to sustain high-intensity effort for longer periods. This is not just a theory shared among fitness enthusiasts. Strong scientific evidence supports it. A meta-analysis published in the Journal of Strength and Conditioning Research reviewed multiple studies and concluded that sodium bicarbonate supplementation significantly improved performance in short, high-intensity activities such as sprinting, swimming, and cycling. Researchers found that athletes who used baking soda experienced slower fatigue and were able to maintain peak performance for longer durations. In practice, many athletes mix about 1 teaspoon of baking soda in water and drink it 60 to 90 minutes before training. International sports bodies, including the International Olympic Committee and the American College of Sports Medicine, recognize sodium bicarbonate as an evidence-based performance enhancer. However, there is one major drawback. It can cause digestive issues, including bloating, cramping, and diarrhea. For this reason, dosage and timing must be carefully adjusted, and each person may need to experiment cautiously. For older adults who still enjoy regular exercise, whether it is cycling, swimming, or simply keeping active, this natural method could be worth considering. If you want a safe, science-backed way to increase endurance and get more from your workouts, baking soda may offer support. Just be sure to consult with a healthcare professional before adding it to your routine, especially if you have existing health conditions. Try it wisely and see if your next workout feels different. 9. May help improve kidney function. Imagine if something as simple as baking soda could help protect the kidneys and support their function, especially for those living with chronic kidney disease or CKD. For many people with CKD, the kidneys struggle to remove enough acid from the blood, leading to a condition known as metabolic acidosis. This excess acid can accelerate kidney damage and weaken overall health. This is where baking soda or sodium bicarbonate shows potential. Acting as a natural antacid, it helps neutralize acid in the blood. By lowering acidity, baking soda may reduce the strain on the kidneys and possibly slow the progression of kidney disease. This is not just a household remedy, it has scientific support. A landmark study published in the Journal of the American Society of Nephrology followed patients with advanced CKD and metabolic acidosis. Researchers found that those who took daily sodium bicarbonate supplements experienced a much slower decline in kidney function compared to those who did not. In fact, the group that used baking soda was less likely to reach end-stage kidney disease and require dialysis. The study also noted improvements in blood bicarbonate levels, an important marker of acid-base balance in the body. Of course, it is essential to remember that baking soda is not a cure and should never be used without medical supervision. Taking too much can cause complications such as high blood pressure or fluid retention, especially for those with heart or kidney problems. If you or someone you know has CKD, it is important to speak with a healthcare professional before considering baking soda as a supplement. When used wisely and under guidance, this humble kitchen ingredient may play a surprising role in supporting kidney health and improving quality of life. 10. May help reduce arthritis. Pain. Imagine finding relief from arthritis pain through something as simple as baking soda, a humble ingredient that may already be sitting in your kitchen. Arthritis, especially rheumatoid arthritis, is marked by chronic inflammation that leads to painful, swollen, and stiff joints, making daily life more difficult. While most people rely on medications and physical therapy for relief, recent scientific discoveries suggest that baking soda may offer a natural and accessible way to help manage these symptoms. Gout is a particularly painful form of arthritis. It often strikes suddenly with severe pain, redness, and swelling commonly in the big toe or other joints. The root cause is the buildup of uric acid in the blood, which forms sharp crystals inside the joints and triggers inflammation. Managing gout usually means lowering uric acid levels and easing the pain caused by these crystals. This is where baking soda or sodium bicarbonate may provide surprising benefits as a home remedy. Because baking soda is alkaline, it can help neutralize excess uric acid in the blood, reducing the chance of crystal formation. By restoring a healthier pH balance, it may lower both the frequency and severity of gout attacks. In fact, research published in the journal Arthritis and Rheumatism found that alkalizing agents such as sodium bicarbonate can help dissolve uric acid crystals and promote their excretion through urine, which reduces acute gout symptoms. There is also promising evidence for other types of arthritis. A 2018 study published in the Journal of Immunology revealed that drinking a daily solution of baking soda and water influenced the immune system. The findings showed that sodium bicarbonate activated the body's anti-inflammatory response while calming the autoimmune activity that fuels conditions like rheumatoid arthritis. Both animal and human participants experienced reduced markers of inflammation and a shift in immune cells toward a less inflammatory state. This suggests that baking soda may help soothe the immune system, reducing joint pain and swelling that make arthritis so challenging. For people living with arthritis, these studies open an exciting possibility. Adding a simple baking soda drink to a daily routine may support inflammation control and improve joint comfort. Although more research is needed to fully understand the long-term benefits, the idea that such a common household item could ease arthritis pain is both empowering and hopeful. It serves as a reminder that sometimes solutions for better health can be found in the most ordinary places. Who should be cautious? Although baking soda offers many impressive health benefits, it is not suitable for everyone. Certain groups of people should be especially careful, particularly when considering frequent use or higher doses, whether taken internally or applied externally. For example, individuals with kidney problems need to be very cautious because baking soda contains sodium. Those with reduced kidney function may struggle to eliminate excess sodium from the body, which can lead to fluid retention and other complications. People with high blood pressure should also be mindful, since the sodium content in baking soda may raise blood pressure and increase risk for those already managing hypertension. Similarly, those with digestive disorders such as stomach ulcers or gastritis should avoid it. The carbon dioxide gas produced during digestion can stretch the stomach lining and, in rare cases, increase the risk of perforation. Pregnant or breastfeeding women are another group that should use caution. Excessive intake may disturb the body's electrolyte balance, affecting both mother and child. In addition, people with a history of allergies or sensitivity may experience skin irritation or digestive discomfort when using baking soda, so it is wise to test a small amount first. Those taking certain medications also need to be careful. Baking soda can change the pH of the stomach and urine, which may interfere with how the body absorbs or eliminates drugs. It may reduce the effectiveness of some antibiotics, such as tetracycline, or antifungal medicines like ketoconazole. It may also increase the risk of toxicity from drugs, such as aspirin or lithium. A rarely discussed but serious danger is stomach rupture. This rare emergency occurs when baking soda is taken after a large meal or with alcohol. The chemical reaction between baking soda and stomach acid produces a large amount of carbon dioxide almost instantly. If the stomach is already full and stretched from food or drink, the sudden gas expansion can increase pressure enough to cause a tear or rupture in the stomach wall. Medical reports have documented this phenomenon, usually in cases where people used baking soda as an antacid after overeating. For this reason, it should only be used in small amounts, preferably on an empty stomach, for occasional heartburn relief. Finally, individuals with respiratory issues should avoid inhaling baking soda powder, since it can irritate the airways and worsen breathing problems. In all cases, moderation and proper guidance are essential. If you belong to any of these groups or have underlying health conditions, it is best to consult a doctor before adding baking soda to your health routine. Baking soda is a powerful chemical agent with scientifically proven therapeutic effects. From neutralizing stomach acid to buffering muscle acidity in athletes, its uses come directly from its alkaline nature. Yet its strength requires respect and caution. It is a valuable tool for short-term relief and for managing specific conditions under medical supervision. It is not a cure-all or a daily supplement for overall health. Understanding both its mechanisms and its risks allows us to appreciate its true value while avoiding potential harm. Have you ever used baking soda for any of these remedies? Share your experiences and questions in the comments. If you found this detailed analysis helpful, please like, subscribe, and share it with others who value health information based on evidence.